Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. In the past, I've made videos about sleep hygiene. One of the methods that we use in our office is recommending a weighted blanket. Now, can weighted blankets affect sleep? Yes. It's not meant for everybody, but there are certain populations that can benefit from using a weighted blanket. So let's go into it. Will the weighted blanket affect sleep? Studies have shown that it manages patients who have anxiety and help them sleep a little bit better. It has positive impact on falling asleep and also staying asleep. It can be used for children and adults who have ADD or ADHD, as well as autism spectrum disorders. There's definitely less tossing and turning when using a weighted blanket, and you want to give yourself at least 7 to 10 days to get used to using the blanket. Now, how much should the blanket weigh? Now, that can vary, right? But the average would be 10 to 15% of your body weight. It can go up and down depending on what you like. I would also recommend using a cotton fabric rather than anything that's synthetic, right? So you can use a weighted blanket, which is about 10 to 15% of your body weight, and it could impact your sleep. Now, how does it work, right? So the studies have shown that it improves sleep for people who have anxiety, but how does it really work, right? So I used to be an artist when I was in school, so let's go right into this. A weighted blanket provides continual afferent stimulation. It stimulates our body and skin and weight receptors into the body, and it goes up to the brain. Once it hits the brain, it starts to impact our neurotransmitters. So the continuous afferent stimulation or signaling through the body to the brain will increase serotonin, right? Increase dopamine, which is your happy neurotransmitter. It will decrease cortisol. So that's important because cortisol should go down at night and melatonin should go up. So it decreases cortisol, increases GABA, which is an inhibitory neurotransmitter, and decreases seizures. So once that happens, from the brain, it sends a signal down to the heart, okay, through the vagal nervous system or the vagus. Once it hits the heart, it will decrease your heart rate. So this is the mechanism in terms of how it can help somebody who has anxiety or someone who's got attention deficit disorder or autism spectrum disorders. It can help by continual stimulation affecting neurotransmitters and hormones and then decreasing heart rate, all right? So if you've never tried a weighted blanket, it might be worth a try. So you might want to go online and do your research. Again, use a cotton fabric rather than anything synthetic. The drawbacks are that it can create some heat, right? So if you're someone who doesn't tolerate heat very well, this might not work. But with the upcoming winter months, it might work well for you. Also, if you like air conditioning and use a weighted blanket, that should be fine. All right, my name is Dr. Jin Sung, where clinical excellence meets excellent results. And we'll see you guys next week on the healthy side. Have an awesome day.